where it only targets the cancer cells, the rogue cells, and leaves the good cells alone.
And was diagnosed with prostate cancer a couple of years ago. I followed his protocol of the results are absolutely worth every single second of it. All I can tell you is that the prostate cancer was the excellent news that was put on hold and reversed.
When I was 13, I was diagnosed with terminal brain cancer. I went into remission after about a year and a half, and now I'm completely cured and I got my life back.
My name is Dr. Bernardo. I use no prescription drugs. Normally the patient comes to me in the final stage of the disease, and many times we can turn them around very dramatic. I had cancer, all my nurses are crying. I said, why are you girls crying? Well, you got cancer, you're gonna die, and I'm gonna lose my job. I said, if I can't get rid of my cancer, I deserve to die. A month later, my cancer was normal. La Jolla, Dr. LaChan sent me a patient. His PSA was 4,280. Dr. LaChan said, can you help him? I said, well, how much time you give me? He said, a week. I said, oh, hell, that's plenty of time. He said, he also got bone cancer. I said, of course, it comes with the territory. A week later, his prostate-specific antigen called PSA, which is a marker that identifies the cancer in the prostate, had dropped by 1,000. In 5 weeks, his PSA was 0 point something. 5 weeks, and in 5 weeks, he was completely free of cancer.
A trained medical doctor, and I practiced conventional medicine for about 10 years until I came to the realization that I tried to deny for a long time, and that is that it doesn't work. We are not designed to fall apart. We are really products of nature, and therefore we respond to the biological parameters which define us, okay? So if you are able to approximate that environment in which you would naturally thrive, anything that's a problem, whether we call it cancer, tuberculosis, arthritis, colitis, goes away. We work with people with cancer and they come in, and we usually get people that have already had advanced stages and they've been through surgery, radiation, and chemo, and they are basically told that they have X amount of time to live. It turns out not to be true. Does it make sense if I told you, you know, you're really sick, I've got an idea, let me poison you?
She had gone through 2 surgeries, and unfortunately they couldn't get the tumor out, so then she became a patient of St. Jude. After several months of that, they had no protocol. Now she's cured her brain cancer, and she got her life back.
So basically telling the cells basically to commit suicide, and that's what they do. And we demonstrated that that would be the mechanism by which the cannabinoids can kill the cancer, and therefore it can be used effectively as an anti-cancer agent.
Dr. Niagara-Cotti and his researchers were able to eradicate almost 100% of the cancer.
They were completely cured.